So, you're thinking about having children after a vasectomy. It's a question a lot of men and their partners think about as life goes on. Today, we're going to explore the different paths to fatherhood that are out there. Let's break down the options.
Hey, life changes, right? Families grow, situations shift. It's totally normal to rethink family planning. And the great news is, if you've had a vasectomy and are now thinking about kids again, there are some really clear, well-established ways to move forward.
So, what are your options really? Well, it pretty much boils down to three main paths you can take, and we're going to get a good look at exactly how each one works.
Okay, first up, and this is the most common route, is a vasectomy reversal. The goal here is pretty straightforward. Reconnect the tubes that were separated during the vasectomy. If it's successful, this allows sperm to get back into the ejaculate, giving you the chance to conceive naturally.
Your second path is something called sperm extraction, or TSE. See, even after a vasectomy, your body keeps making sperm. So with this procedure, sperm is collected right from the testicle. That sperm is then usually used for in vitro fertilization, IVF.
And then there's a third path, which is kind of the hybrid option. It combines the first two. You'd get the vasectomy reversal, but at the very same time, some sperm would also be extracted and frozen. This gives you a shot at a natural pregnancy, but with a really solid backup plan for IVF if you end up needing it. It's kind of like an insurance policy.
All right, let's zoom in a little on the most common choice here, the vasectomy reversal. Really understanding how this procedure works is going to be key to making a decision you feel good about.
Now this is some really delicate and super specialized work. It's very different from the vasectomy itself. We're talking about microsurgery. It requires a powerful operating microscope and stitches that are incredibly tiny to precisely reconnect that tube that carries sperm.
During the procedure, the surgeon actually has two main techniques they can use. The first is a vasovasostomy, which is where they connect the two ends of the tube directly. But if they find a blockage closer to the testicle, they'll perform a vasoepididymostomy, which connects the tube directly to where the sperm is stored. The surgeon makes the call on which technique is best right there during the operation.
So, how well does it work? The results are actually pretty amazing. For reversals done within about 10 years of the vasectomy, the success rate for getting sperm back into the ejaculate is typically over 80%. That's a really encouraging number if you're thinking about this path. Of course, after any procedure, you got to think about recovery. So let's talk about what you can expect in the weeks right after reversal. The recovery is actually pretty manageable. You'll go home the very same day just to rest up. Now, the first couple of weeks are really important. You have to avoid any heavy lifting and stay out of baths or pools. And then, usually within about 3 to 4 weeks, you can get back to normal sexual activity.
So here's the bottom line. You've got options, but figuring out which one is the absolute best fit for you and your family, well, that really depends on your unique situation. And that's why the real next step is having a personal conversation with an expert. To learn more and get advice that's tailored just for you, you can schedule a visit with a specialist like Dr. Nanan Thirumavilavan at Cleveland Men's Health. A consultation is your chance to ask all your questions, understand all the details, and make a plan that feels right for you.